Okay, there we go. So I'll scoot through these pretty quickly. I'm hoping we'll have time to show. We've just released a video about some of the work the alumni are doing. So well, try to scoot through these quickly so we have time for that at the end. So, you know, the funding body of the fellowship program, or one of the major funding bodies of the fellowship program, is the Commonwealth Fund. We won't spend a lot of time on the Commonwealth Fund, but I thought it would be important just at the beginning to acknowledge them as our funder and also the work that they do around advancing health equity. So that the president of the Commonwealth Fund, along with Dr. Joan Reed, which I'll talk a little bit more about in a minute, started talking about how they can improve health equity in the healthcare space back in the mid-90s. And they collaborated between the Harvard School of Medicine and School of Public Health, along with the Commonwealth Fund, to create this program called the Commonwealth Fund Fellowship in Minority Health Policy. So I'm talking to a group of like-minded individuals today. So we know that the problem of racism is deeply embedded into our healthcare system, and that is one of the major drivers of health inequities. And so without addressing that, and thankfully in the recent years, we have been becoming more comfortable with calling racism a healthcare crisis and addressing it in a more purposeful way in the healthcare system. But this is, of course, not new. And it's something that we know has been a problem for a long time. So when they created this fellowship program, they wanted to think about really creating a leadership pathway for the Commonwealth Fund is specifically for physicians, but there are other arms of the fellowship program as well. One of them is the Joseph Henry Fellowship arm, which is specifically for dentists, but really creating a space to train clinicians, specifically physicians and dentists, around healthcare disparities and inequities, and allow them to have the fundamentals, the knowledge, the support in order to re-enter the healthcare system in different spaces to create change. So that's kind of the background in the model. So as I mentioned, the founder of the program is Dr. Joan Reed, and she still works at Harvard in the Office for Diversity, Inclusion, and Community Partnership. And our fellowship program is one of many programs that she has that is working towards improving health equity at every level. So we won't go through all of those programs today, excuse me, but I will share a link to the website. You can kind of go through those at every level. So the first one, the community engagement and education, is actually starting at the K through 12 level, supporting students in elementary school, also in supporting the teachers in the K through 12 level as well. So all of our programs are very much supportive of a community engagement. There are opportunities for college and undergraduate students, medical students, postdoc and fellow would be where our program is, the Commonwealth Fund Fellowship in Minority Health Policy, but there are also opportunities at the faculty level as well. So if for those of you who are interested in increasing your leadership skills around health equity, there is something literally for everyone housed in her office. Some of the things are very local and specific to the Boston area. Some of them can be a visiting program for our college and medical students and graduate students who can come for short periods of time. One of those is the VCP program, which is 30 years in existence. So as a medical student, you can come and do a visiting clerkship rotation in the Harvard program and also get exposure to Dr. Reed's office and some of the other programming that she does. So there's something for everyone. And so even if not for you, maybe one of your mentees that you may be fostering along the way. So again, the fellowship goals, especially, this is specifically for the Commonwealth Fund Fellowship in Minority Health Policy, is to support physicians to become leaders in the healthcare space, specifically to support disadvantaged and vulnerable populations. Again, it's going to improve representation in the pipeline and across the workforce spectrum. And then we stay involved with each other as alumni. So we know that a lot of times when you're out in these spaces, you may be the only person who looks like you or the only person who's interested in promoting health equity agendas. And so we still provide support for one another, for sounding boards, for resources, for speakers, whatever you can imagine. We are still there for each other after the fellowship is done. The eligibility, like I said, you have to be completed with your training. So this is after your residency is completed. Of course, you need to be in good standing. You generally get a master in public health as part of the program, but there are those who enter the program who have already received their masters in public health. So another option would be your masters in health policy. And there's some other offerings. It can be tailored to your needs depending on what you come in with. And so after the fellowship, as I mentioned, people go on to do many different things. So as you can imagine, we all come from our own clinical space and we're well represented across the spectrum. So we are as involved with our primary care specialties as we are with our surgical subspecialists. 100% of us are engaged in some kind of health policy or health equity work. Some are in the academic spaces, some are in the federal system, some are in local and regional health departments. So it's kind of across the gamut, but we're really prepared to go back to our communities that we are trying to serve and try to improve health outcomes overall. And so, like I mentioned, it's a family affair. So this is actually my cohort. It's a very supportive group. We spent time with each other in the classroom, studying together, but also in each other's homes. We visited Atlanta, it's Martin Luther King Jr. III. We went to the fireworks show, we went to baseball games. And why is that important? Again, we have to support each other as leaders on an everyday. But I think it's also important to support each other as people. And so it's really about building up your entire person, not just you as a clinician or as a leader. The alumni group of this organization is the Reed Scholars. And as Dr. Defoe mentioned, we are a nonprofit organization. We have a few signature events each year, one of which is the Health Equity Symposium, which pre-COVID is held annually in May in Boston, which is open to everyone. We have an annual leadership retreat, which again fosters the ongoing leadership development of the Reed Scholars as individuals. So that's just for our membership. And of course, we meet throughout the year. In fall of 2019, we started an interactive podcast called Reed Scholars Live, where we talk about health equity issues with health equity experts across the country. We talk both with Reed Scholars and non-Reed Scholars, but really trying to talk about health equity outside of the healthcare space, real life practical applications, innovations. How do we really start to move the needle and make change in addition to the academic and research conversations? So this is just a brief overview of some of our alumni and what they are doing now. Again, I'll read this to you, but people are doing very innovative work, creating spaces where there weren't any spaces before. And Joseph Betancourt did a lot of work in Boston, creating the Diversity Innovation Center. Might mess that up just a tad, but we have people who are working again in the federal space, as the HHS, at the Corey in the research space, in the managed care and accountable care space for companies like Humana, people who are so heavily clinical and working in the academic space around medical education. We have people who are more in the community health space, working with federally qualified health centers and really doing local community programming and trying to change outcomes there. We have people who are working kind of across the board, and even Dr. Warren has been tagged for one of President Biden's initiatives around programming for Indigenous people, and then of course directing public health departments across the country. So I'm going to try to show you this video if we have time. Am I okay for time? So stop share here. When the pandemic hit, the Commonwealth Fund Fellowship had already been training leaders in minority health policy for more than 2 decades. By then, more than 140 fellowship alumni 100%, have been actively engaged in aspects of policy, research, and or service delivery related to minority health and or public health. And a significant number have assumed leadership roles in federal agencies, state, county, city departments, and or in national and regional organizations and associations. No one could predict that the pandemic would strike when it did, but we knew that a crisis like this would worsen disparities in our healthcare system, and the Commonwealth Fund Fellows were ready to respond. This is what we have prepared for.
What I remember from that time really is just the profound uncertainty. I remember not knowing what direction we were headed in, looking at Italy, looking at New York, wondering what was coming our way.
Having a public health lens and having an understanding of how to protect the public is very important in the delivery of care, because it allows everyone to think about all of the paths and the levers we need to pull, paths we need to take and the levers we need to pull in order to maintain a sense of order and elevate health for everyone.
So the fellowship had a way of training me to think bigger and higher than what the issues might be happening at that moment. And so for an example, as Chief Diversity and Inclusion Officer, I was thinking through COVID and how it impacted our patients, but also how is it impacting our underrepresented in medicine faculty and trainees and students.
From the very beginning, there was a disproportionate burden of cases, hospitalizations, and death amongst Black and Indigenous people of color. And the disparity seemed to widen as time went on. The fellowship certainly provided me with a network automatically of experts as it pertains to how to address disparities in care and outcomes amongst underrepresented or minority populations. It also demonstrated to me, or helped me to better understand how we can meaningfully partner with people, whether it be folks in our community, whether it be organizational leaders from grassroots to corporate, or whether it be our civic and government officials to enact change.
And if it wasn't for the fellowship, I don't know that we would make progress in some of the public health actions. We're able to building epidemiological data, making sense of what was going on and helping people who were in dire need. The fellowship, is an incredible community of people that even to this day continue to do things to address the pandemic. And think about how do we, recover, rebuild, have resiliency, and reimagine the future so that we're not in this position again.
I want people to stop talking about health equity just with like-minded peers in an academic space and really start to have this conversation amongst their friends, in the beauty shop or at the barbershop or at the PTA meeting and that type of thing. Because that's really how we affect change. We have to talk about it with people who don't look like us. We have to talk about it outside of the healthcare space.
We're really at an inflection point. This is a window of opportunity for change. So then how do you harness that opportunity? How do you use this as a chance to finally address structural racism, achieve health equity in a sustainable way? And I would say, what could possibly be more important right now?
Even though we're trying to address the issues related to COVID-19 and the pandemic, the other healthcare inequities that were present before the pandemic are existing through the pandemic and will last beyond the pandemic. So I think that our fellows are uniquely positioned because we've been thinking about health equity and health policy for years, and now we can apply our lessons learned through the lens of a pandemic, focusing in on addressing those health inequities that other leaders may not be thinking about because they may have other areas that they're trying to focus in on. And I think there are opportunities for the fellows to step in and to lead in the spaces where leadership is lacked. And I think that's one of the fundamental strengths of the fellowship is people are given the tools for success.
So with that, I am finished with my comments. I have some contact information that I can share quickly, but we can also.
Good afternoon, and thank you for joining us. My name is Alden Landry.
Dr. Fleming,
Thank
yeah, we thank you for sharing this opportunity.
Yes.
Yeah, I also want to highlight how valuable further training in public health and health policy can be in eliminating health disparities. By sharing this little known Hopkins fact, you know, Johns Hopkins School of Public Health graduated the first African American in 1946. The physician, Dr. Reginald James, he went on to be a public health service officer in Alabama. And he was very valuable. He was a very valuable advocate in the campaign against syphilis among Blacks. And he was among those who, in 1973, declared the infamous Tuskegee syphilis study ethically unjustified. So again, thank you very much. And hopefully those who are listening will take this opportunity and share it to people that they know to, you know, apply to this program at Harvard or of course at Johns Hopkins to get further training in public health and health policy. Thank you so much. We will continue. Do we have any questions?
Yes, there's one question there. Are there any opportunities for current medical students? Wait a minute, where it went? Wait a minute. It's just, here it goes. Are there any opportunities for current medical students who want to pursue an MPH by taking a year while enrolled in medical school? Dr. Fleming?
I think there are plenty of opportunities. I mean, you can always just apply for an MPH program at your local institution or at Harvard. When I was there for the fellowship program, some of my classmates were medical students from other institutions that we remained close with and took some classes with. For that particular office, the major opportunities would be a visiting clerkship program. But, you know, a lot of people who actually did the fellowship started in the clerkship program or one of the other programs and found out what their opportunities would be throughout their training. So the short answer is yes, we can find something that makes sense for you depending on where you are in your training and where you are in your journey. And you can definitely, you know, follow up with me offline and we can kind of talk through what those opportunities could be specifically.
Okay, thank you so much.
Thank you so much.
Since there aren't any other questions, Deidre, would you like to introduce our next?
Thank you. So we will certainly continue our discussion with our next presenter, Dr. Sarah Hemminger. Dr. Hemminger is an alumna of Johns Hopkins and received both her undergraduate and her graduate degree in biomedical engineering. She's the co-founder of Thread, which is a local nonprofit in Baltimore area, which has designed an innovative mentorship program that not only increases the rate of graduation of high school students, but also plays a major role in breaking the cycle of crime. So Dr. Hemminger, thank you for coming to share this innovative mentorship model. Thank you so much.
I think we just lost Dr. Hemminger.
She will join back. Let's see.
I'm so sorry, but I just went to spotlight her and she was gone. So thank you so much, technology.
Yeah, she should be joining back. We'll open the table for discussion also. I could circle back to the previous question about opportunities during medical school. I myself took an opportunity with Harvard when I was in medical school and did do the internship, in the 1990s at Harvard. That was very good. I mean, you get exposed to pretty much whatever area you would like. I did reproductive endocrinology and infertility, but there are lots of opportunities for community work. I think Dr. Reed provides housing and also a stipend to do this. I remember receiving that. Thanks. And that
Deidre,
inspired
thank
me
you
to
so
look
much for sharing that. And it looks like we've got Dr. Hemminger back.
back.
We lost you, but you're back.
Oh, sorry. I'm so sorry.
Okay, no worries. So we introduced you. You could go ahead and tell us about this innovative program. And thanks again.
Wonderful. So thank you very much for having me with you today, and I apologize for the technical difficulties. I wanted to just start off by sharing a little bit about myself and how Thread was founded and how that connects to the bigger picture of health equity that we've been discussing today. So when I was in high school, my best friend Ryan's family unit was completely shattered. His mom was in a car accident. She was temporarily paralyzed. She ended up losing her job. They had to move from suburbia into Section 8 housing, and she became depressed and addicted to painkillers, and then began selling them in order to support her own habit. And so this all coincided with my friend Ryan's transition into high school, and he ended up failing all of his classes his freshman year and was basically going to drop out. But there was a group of teachers that totally band together to not only provide things like tutoring, but also clothing and food and money to keep running water and heat in his home. And, while no one can make decisions for you, you can certainly make someone's decisions easier. So it was a lot easier to choose to go to school when he had a ride, and it was easier to choose to go to school when he had a place to do his laundry and wasn't worried about being teased. They really became, these teachers became Ryan's extended family. And by the time he was a senior, he was an honor roll student and he was a varsity athlete and was preparing to attend the United States Naval Academy. And I like to joke, my first strategic planning process was really convincing him to date me and then marry me. So fast forward a little bit, in 2004, Ryan and I founded Thread. And Thread is a community that works to harness the power of relationships to improve outcomes for young people who are facing the most significant opportunity gaps and structural barriers. And at the time that we founded Thread, I was pursuing my graduate studies at Hopkins, and we're taking first-year medical student courses. And I was feeling really disconnected as an introvert. I didn't have any family in the area. I was struggling to make friends. I felt out of place, and I just was desperately searching for a way to feel connected to other people. And it dawned on me that there must be other high school students who are, just like Ryan, who were exceptional individuals, but they might be in really extraordinary situations, and that maybe together we could find that sense of belonging. And so that's how Thread was founded, was out of my desire to find friends. So Thread enrolls high school freshmen who rank academically in the bottom 25% of their class and face abundance of challenges in and out of the classroom. Each of our ninth graders are paired with up to 4 volunteers. So it's a group of university students, small business owners, empty nesters, professionals, retirees here in Baltimore City. And essential to our ethos is that each of the volunteers also has a trained coach who works with them on how to build relationships and bond across lines of difference. And so together this group forms what we call a Thread family. And this Thread family does whatever it takes to support a young person. And that could be rides to school, refurbishing their house, ice cream on the weekends. In COVID, it has meant sometimes delivering groceries or actually having a young person Zoom and attend school from a volunteer's home throughout the day. The way to think of it inside of Thread is if it's something that you would do for your own child or your niece or nephew or your sibling, then we would do it for someone in our community. And then Thread also provides program spaces like after school tutoring, camping trips, community service outings on the weekends. And the goals of these outings are really to create spaces where young people and volunteers can come together and really hone their skills, figure out what they're passionate about, what they love to do, and then how to apply both their skills and their passion in the world. And then to make sure that the Thread family can focus on their relationships with one another, oftentimes when a young person is set a goal for themselves, they might run into a barrier. And so we have teams of collaborators who provide pro bono expertise on everything from preventing evictions to accessing adequate health care. And I think probably the most important thing is that when you want to build enduring relationships and weave a social fabric that is strong, that takes time. It takes time to build trust. And so we commit to each young person that we enroll and their family for 10 years, so longer than your average American marriage. When I think about the Thread community, for me, the past 18 years have really been shaped by the relationships that I've had, one of which was with a young person named Judy. And when I first met Judy, she is introverted, much like myself. She wasn't going to school. She didn't really want to talk. I didn't really want to talk. But eventually, I'd catch her in the hall and maybe give her a ride home. That turned into giving her rides to school. And over time, what I came to understand is that she was just struggling most days just to get out of bed in the morning. She was suffering from severe anxiety and depression. She had been physically very badly abused by a close family member. And so for her, it was just a struggle to go to school. And yet, just like Ryan, just completely brilliant, beautiful human being. And so over time, our relationship grew. Lots of times that meant rides to school. It meant, over time spending most times hating our camping trips. But Judy ended up not only graduating from Dunbar High School, but she went on to receive her nursing degree from Wesley College and then her master's degree. And for many years was actually a nurse at Hopkins Bayview. And so I think one of the important things to point out is not just about what Judy achieved, but it's the deep compassion and empathy that her lived experience has allowed her to bring to the world. So when we were sitting there at her college graduation, I remember asking her what aspect of nursing was she going to pursue, and she said, "I'm going to go into mental health." And I said, I was surprised. I thought, why mental health? And she said, well, because with every other disease, when you get sick, your family and friends, they flock to you. Heart disease, cancer, they want to help you. But with mental illness, most people walk away. And she said, I just want to be the person who's still there when no one else is. And so it's, relationship with Judy has evolved over time. From those rides in the car where lots of time, we'd argue about what music to listen to. She would tease me, about arguments about fashion, my shoes. I like to wear Rockports. You'll never find me in a heel. And that just kills her to this day. But as we got to know one another, we would also talk about the mental health challenges she was facing, and the fact that I've lost now 4 family members to suicide. As we kind of grew into adulthood together, we both struggled to have children. And so sometimes we would just be sitting in spaces together and there was really nothing to say. It was simply to be present for one another in those really difficult moments. And we also shared the joys of life. We both eventually gave birth to our daughters, Linda and Evie, 5 months apart. So they are now growing up as, they would call it, sisters and the best of friends. And I think the thing that, we've really taken away from this time in our relationship is it's not just our young people who need deep interpersonal bonds. It is something that we all need. And so 5 years ago, I was in a really bad car accident. I had a severe concussion. As a result of it, I ended up losing about 30 pounds. Don't worry, I've gained it all back. And I was very, very sick. I was just driving home one day and I had a massive panic attack. And I didn't know what was happening in my body because I hadn't had one before. And my husband's grandfather had just passed away and he was supposed to travel and go to the funeral. And I was terrified because at the time my daughter was 2 and I didn't know what was happening in my body. And the idea of being home alone with her frightened me. And even though I had, 5,000 friends on Facebook, in that moment, it was actually who could I call that I felt I could fully be myself with and that could sit with me in that moment. And of course I called Judy. And so she and Lynn came over, spent that weekend with me and Evie. And it was just this deep sense of knowing I had a place in that space with her and with our children. And I think that is really what over this long period of thread that we've really learned is that, yes, Judy is special, but she is not unique. So when you look at Baltimore City students who have GPAs of less than 1.0 during their freshman year of high school, only 6% graduate in 4 years. Even though the average incoming GPA of young people in thread is 0.79 on a 4.0 scale, 65% graduate in 4 years, so a logarithmic scale greater, and then 79% if you extend out to 6 years. And then when you look at our young people and what they achieve moving into adulthood, 62% have a 4-year or 2-year degree or certification. And so they are emerging and continue to emerge as leaders, both in their families, in their community, in thread. Young people now are on our board, on our staff, in our volunteer base. And so things have really come full circle. And so when we think about what is the broader change that we want to bring, it really is literally come from a single insight over these past 18 years, which is this. If we want young people to get up and go to school, then if we say we're going to take them to school, we have to follow through on that commitment and actually show up. So it's about building trust by being sincere, reliable, and demonstrating competence. But it's not just about showing up, but it's how we show up. So do we actually show up in a way that's vulnerable? Do we invite a young person into our lives and help them see what things we're struggling with? Do we move from an orientation of I'm here to help you to I need your help? And that is really where we have found the power in the relationships over time and thread, is when the relationships are truly authentic and bidirectional, where both individuals are showing up with this acknowledgement that we all have things that, we have a unique lived experience. And from that unique lived experience, we have things that we can share and help others to grow in. And there's also areas that we can learn and we can grow and change ourselves. And so that's driven kind of our broader direction as a community, where now we are working to get to a scale of enrolling 7.5% of all high school freshmen across the Baltimore City Public School District each year. That's important because getting to that scale while maintaining the same level of outcomes would actually materially shift the education outcomes and the high school graduation rate citywide. We think that's important, but we think what's even more important is what it would also do is mean that you would have 20,000 people in Baltimore So 5% of the entire adult population in the city are young people, their families, volunteers, their families, collaborators, donors, staff, board, all knitted together in relationships where we've actually created conditions for belonging and real affirmation that allow each of us to show up as our full selves while not impeding on someone else's ability to do the same. And so that's the broader change that in parallel to changes in policy, institutional changes, you know, when we think about it, institutions are run by people, communities are made up of people, and policies are written by people. And so what we want to do is help as a community, each of us on our own individual journeys to understand our own bias and knowledge and attitudes and beliefs in a way that we build the muscles to then truly be able to bridge and bond with others across lines of difference. So I just appreciate the opportunity to share with you about kind of thread and how we've evolved, and just the sheer acknowledgement of our young people in your invitation is greatly appreciated.
Dr. Hemminger, thank you very much for giving hope to our community, and hopefully we'll have questions on how others could use this model in other communities. We're open for questions.
I know the question had to do with wondering how this program could be scaled up so that it, because it has such potential, but how can it be scaled up, I guess, as you were talking about in terms of expanding it, that you had made reference to, but also as Dr. Defoe had said, how can this also be applied in other areas? Because as we know, Baltimore is not, unfortunately, is not alone in this challenge that, you know, most of our urban cities has this. So is there a way to help expand on this, but also replicate this in other parts of the country?
Yeah, I think it's an and. So the way that we've kind of codified what we've learned is in a really simple 5-step process we call the thread engagement process. So it's how you actually build and strengthen a relationship. So first you connect, which makes sense. Like you actually have to have connection with someone. And then you set goals. You identify barriers, work through barriers, and attain goals. And it's kind of just a rinse, repeat, rinse, repeat, rinse, repeat. And what's interesting about the process, though, is that you can apply that process in any context. You could apply it in a family, in a workplace, in a community organization. But the critical part is in the goal setting aspect of it. It's, are you actually setting bi-directional goals? So I'll give you an example. Just I had eye surgery a few weeks ago, and a young man, Leroy, who I've known now for 15 years, he had some car issues and was going to have trouble getting to work. And I was having trouble getting to surgery because it was very early in the morning and my husband couldn't both drive me and my daughter. And so I had a need, which was to get to surgery. Leroy had a need, which is to get to work. So the simple solution was for him to have my car and make sure I got to surgery and then use the car to get to work. So that sounds like a very simplistic example, but that's the thread engagement process in real life. And so anyone can take that and apply it in any context. And the question then you want to ask yourself, I think, is, are you showing up in a way that actually has some vulnerability and allows someone else to help you, which is very counterculture. And I think it's equally important, given especially how incredibly accomplished this group of folks is just also the person in the relationship who's in the position of more power and privilege in terms of who meets who, where they're at. The way we think about that in the thread community is that power and privilege can come in a lot of different forms. It could come just in the age difference, for example, between two individuals, but that it's on the person with more power and privilege to try to change their vantage point and meet the other person where they're at first. And that's how we think about kind of equity in a relationship. And so part of what we're doing in terms of getting to scale is we're actually deploying the thread curriculum for how to do this in non-thread contexts. And that's twofold. One, it's trying to build those muscles, not just inside the thread community, but one thing, you know, that I have come to a different understanding of as a white woman walking alongside our young people now for so many years is just, they can graduate from high school and they can graduate from college and they can go buy their first, but they're just walking into a world that is not meant for them. And until we change that, it is a constant increased allostatic load to just exist. And so that's like the deeper change that has to happen, where the world, I think, could look different, where our young people walk in and their shoulders can just fall and they can just be themselves. And so part of why we're deploying our curriculum in other spaces is so that then when our young people enter those spaces, as they, you know, step out into different aspects of their lives in the world, that hopefully we're doing that change, not just internally in ourselves and in individuals in thread, but in the communities, workplaces, and institutions that our young people are stepping into.
Exactly. Which brings up another question that's in sync with what you were just sharing. In terms of doing those expansions, what type of major barriers have you encountered in your efforts to expand? Because as you said, it's not just the services, it's how, you know, the minority communities are perceived and the impact that that has.
I mean, without question, the biggest barrier is a culture of white supremacy, because the vulnerability flies in the face of the narrative that has been told to our young people, implicitly, explicitly, repeated, and traumatically, which is that they are marginalized, that they, all the words that I just don't even, like it just, and so part of it is what we see in when you change the orientation of the relationship, that is the hardest thing to do. And it's like the entire thing. So it's like the barrier is the work that we all have to continually do inside of ourselves to like, it's just never done. Like there's never like one day where you wake up and you're like, I got my bias situation fixed. Like it's just, it's continuous and it's imperfect and it's messy. And that is, it's really the work is getting people comfortable being uncomfortable. And so that's the biggest barrier, and that just takes time. But I think what's really been inspiring for me is that I've seen it happen. I watch it happen every day. And once you get a critical mass of people behaving in that way, it then shifts the norms in a way that it becomes unacceptable to behave any other way. And so it's how do you get to critical mass and a tipping point inside of clusters and then at a broader scale.
I think the other piece of that, as you said, is that because white supremacy is still here, it's, you know, how do you engage other like-minded people that are not part of the minorities? And also to veggie back off of that question is, I know I've been a school social worker in New York for many decades. And I know that there've been times when we have collaborated with other organizations that do sensitivity work. So I'm curious if within your program, if there are times that you have collaborated with others to help sensitize the white supremacy communities around the fact that, yes, we are human beings also, we have capabilities also, but also within those systems, because as you said, with education, part of it is that the way they're taught is to the weakness of our children. Most of our boys in particular are experiential and circular learning, and the teaching skill is linear, you know, A, B, C, not you and me. So in that, are things, aspects like that also addressed? Because it's one thing to give them, and that's tremendous, but also looking at the systems and how they're set up to sabotage our children from being more than just those percentages.
Yeah, I think that is it's actually the stage of evolution that our alumni are leading now, which is, it's an and strategy. So it's making, like, it's our alumni both working within the existing systems to build assets in their families, right? So the challenge with education is you can't pass that down to the next generation. You can pass a house down, right? And so it's building actual assets. So that's one piece of it. And then to your point about the systems, to me, it's more like water eroding rock. Like there's a role for dynamite, and then there's a role for water eroding rock. And it just depends what part of the bridge you're trying to build at the time and what the impediments are. And so some of it is just over time, and working with all layers of different institutions to actually address kind of the cultural things, and then the way that that gets written into policy. And I think a lot of that, again, it's like still, it's always going to be a work in progress for me and inside a thread, but it's also a process of truth telling around what has been. Like even just getting to shared terms and agreement around reality is in and of itself a task. But once you have shared language and a shared understanding of history, that's a great starting point for the conversation.
Right. No, that's very true. And we thank you for both of you for the wonderful. At this point, Alicia is going to help us close out for this segment. Let me thank you both for the wealth of information that both of you have shared during this time. Alicia?
Thank you, Nafra, and thank you very much to our guest speakers, Dr. Fleming and Dr. Hemminger. We really, really, really appreciate it. You both taking the time out to join us today for our first anniversary. If anyone's like me, I'm sure you all, took a lot from this conversation. So thank you from me to you, to everyone for showing up. And thank you to all of those of you who took time out of your busy schedules to be here today to join us for this very important conversation. I'd like to remind everyone that, when we have these monthly discussions, we will send out the resources. We will have minutes from the call and slides that we'll send out as a follow-up. And I want to remind everyone that we do have meetings monthly, and our next meeting is scheduled for December the 2nd, which is a Thursday. Meetings are at noon every month, so make sure you look out for that registration link via the Hopkins emails. And then also want to remind everyone that in January, we will have 2 special guest speakers join us. We will be joined by Dr. Sharita Golden, who is Vice President and Chief Diversity Officer for Hopkins Medicine. And we will also be joined by Dr. Katrina Caldwell, who is Vice Provost for Diversity and Inclusion and Chief Diversity Officer. Both Drs. Golden and Caldwell will join us to discuss the Johns Hopkins Roadmap, future directions, and we'll take questions. So we hope that you all will join us for that conversation as well. Again, make sure you check your inbox, look out for the link to register, and we hope to see you for future conversations. Thank you all very much for joining us today. Be well.